Hello, this is Dr. LeBlue again, representing hypnosishelps.info, and I'm here today to tell you about how hypnosis helped a client patient who had a severe fear of flying, which had persisted for years in spite of 2 failed treatment attempts. The client patient in this case was no ordinary type. She was a graduate student in social work and therefore had a better than average understanding of such things as a fear of flying. What's more, she even had a husband who worked for Pan Am as an accident investigator, and needless to say, that was a significant diagnostic fact to consider for this case. In fact, one psychiatrist even saw it as important enough to determine that the fear of flying she was experiencing was a symbolic fear of leaving her marriage, a diagnostic determination which was used as justification for 2 or more months of psychiatric counseling, which helped her marriage but not the fear of flying. The other treatment effort this client made was to pursue treatment from a hypnotherapist who performed a series of repeat hypnosis treatments consisting of 10 sessions and a gradual step-by-step approach of overcoming her fear. But this attempt to resolve her fear of flying was also non-productive. Next, she decided to try hypnosis again with me, and because of her previous unsuccessful attempts, I decided to attempt a different hypnotic approach which proved to be more successful than her first 2 attempts. What happened was that the client patient specific symptom, that is the fear of flying, was given a simple hypnotic diagnostic examination and evaluation that revealed the real cause of the fear, and at the same time helped to resolve her fear of flying. Interestingly, in describing her fear of flying, she reported she could just look at a plane and get butterflies in her stomach. Also, she reported that when she flew, she had to belt down a couple of martinis and move to a seat away from her family because if there was a plane crash, she would not want to be near her family and see them die. This is a logical thing on the face of it, but when subjected to hypnotic scrutiny, something much more revealing and significant in attempting to unlock the real cause of her fear of flying emerges as following. What was discovered upon hypnotic diagnostic evaluation was that when she flew against the doctor's advice many years before, when she was pregnant for her last child, she had consulted a doctor about flying, and the doctor gave her a stern warning which had a lasting effect on her in the form of a phobic reaction to flying. It wasn't so much the doctor's stern warning, but it certainly had a lasting telling effect in that she had flown against the doctor's stern warning. That is, if you fly, you might kill this baby. But she flew anyway. Well, on landing, there was a near crash which caused her to go into labor, and she couldn't help but experience extreme fear, guilt, and panic, and the thought of the stern warning the doctor had given. And the guilt she had then was so extreme that her mind totally substituted and replaced the guilt of having violated the doctor's advice. And her mind substituted and made her believe the next most logical and acceptable thing, the fear of flying. And that set the stage for many years of her flying phobia. That's the difference psychiatric hypnosis can make in uncovering and the real cause of something like a flying phobia. And this is a typical example of what happens in psychiatric hypnotic practice. Incidentally, this client patient was able to fly successfully without exaggerated fear as soon as a week after this treatment for the first time in years. And she was able to continue to do so thereafter. Once again, I hope this case helps to give hypnosis greater recognition and awareness of the tremendous healing potential of hypnosis. It certainly proved to be healing in this case. What is amazing is that the entire experience she had with flying and this near accident was completely repressed and not recallable in the waking state. One would think that such an experience would have been readily recallable, but not so. In fact, having no recall of any flying near accident caused me to think initially that I was dealing with a case of claustrophobia because the client patient had been locked in a closet when she was 8 years old. And this is one of the reasons I like psychiatric hypnosis so much. It reveals the symptomatic truth and helps to get to the bottom of the difficulty the person is having. In other words, it assesses the subconscious mind like nothing else can. You know, psychologists use written psychological tests to find out what is going on with a client at a deeper level. Social workers and counselors rely on the client's feelings and report of their symptoms. Psychiatrists use brain scans, a medical procedure to more deeply understand a client's brain functioning. But in my opinion, nothing else can help to understand a client's subconscious mind like diagnostic hypnosis methods and procedures. Once again, thank you for giving this case consideration. I hope I have helped to increase your faith and confidence in the diagnostic and healing power of hypnosis once again. If I can answer any questions regarding this case, feel free to contact me. And thank you once again for listening and your consideration.